Right now, one hormone your body already makes naturally is behind one of the biggest shifts in modern medicine, and most of the people using it every week couldn't actually tell you what it does inside their body or why it works the way it does. That hormone is GLP-1, and the medication built around it, Ozempic, has become one of the most talked about drugs in the world. It's mentioned in conversations at family dinners, referenced constantly online, and prescribed more than almost any other medication in recent memory. But underneath all the attention, there's a surprising amount of confusion about what this drug actually is, what it was originally designed to do, and how it produces the effects that have made it so famous. So let's start at the beginning, because understanding where Ozempic came from tells you almost everything about why it works the way it does. Ozempic is the brand name for a drug called semaglutide, and semaglutide belongs to a class of medications known as GLP-1 receptor agonists. GLP-1 stands for glucagon-like peptide 1, a hormone your intestines naturally release every time you eat a meal. In a healthy body, GLP-1 does several jobs at once. It signals your pancreas to release insulin when your blood sugar rises after eating. It tells your stomach to slow down digestion, and it sends signals to your brain that help you feel satisfied and full. Semaglutide is essentially a longer-lasting, modified version of this natural hormone, engineered so that instead of being broken down within minutes like your body's own GLP-1, it can remain active for about a week, which is exactly why Ozempic is taken as a once-weekly injection rather than something you'd need to take multiple times a day. Here's something most people don't realize. Ozempic wasn't created with weight loss as its primary purpose at all. It was developed and originally approved specifically to help adults with type 2 diabetes manage their blood sugar. In people with type 2 diabetes, the body either doesn't produce enough insulin or doesn't use it effectively, which allows blood sugar to climb to unhealthy levels. Semaglutide helps address this by boosting insulin release specifically when blood sugar is elevated, and by reducing glucagon, a separate hormone that normally raises blood sugar. This glucose-dependent action is actually an important safety feature because it means the drug generally doesn't push blood sugar dangerously low the way some older diabetes medications can. So, if it was designed for blood sugar control, how did it become one of the most famous weight loss drugs on the planet? The answer goes back to something researchers noticed during the original diabetes trials. Patients taking semaglutide were consistently losing a noticeable amount of weight as what was initially considered a side effect of treatment. That observation didn't go unnoticed. Because GLP-1 receptors aren't just present in your pancreas and digestive system, they're also found in areas of the brain directly involved in regulating appetite and satisfaction. When semaglutide activates those receptors, it doesn't just slow digestion, which extends the feeling of fullness after a meal. It also communicates directly with your brain in a way that reduces hunger signals and cravings throughout the day. Put those two effects together, a stomach that empties more slowly and a brain that isn't pushing you to eat as often, and you get a medication that can meaningfully reduce how much a person eats, largely without the constant, exhausting willpower battle that so many weight loss efforts require. This discovery was significant enough that pharmaceutical researchers eventually developed a higher dose version of semaglutide specifically for weight management, which reached the market under a different brand name, Wegovy. Ozempic and Wegovy share the exact same active ingredient. They're simply approved for different purposes and dosed differently. This is part of why so much confusion exists around these drugs. People hear both names constantly, often without realizing they're built around the same underlying molecule. What's made this entire class of medication such a significant moment in modern medicine isn't simply that it produces weight loss, it's that it does so by working with the body's own hormonal signaling systems, rather than relying on stimulants, appetite suppressant tricks, or the kind of aggressive metabolic manipulation that characterized many older weight loss drugs, some of which were eventually pulled from the market over serious safety concerns. That doesn't mean Ozempic is without risks or without important nuance, and it certainly doesn't mean it's the right choice for everyone. But understanding this mechanism, a hormone your body already produces, adjusted and extended to work longer, doing the same essential job your digestive system does every day, just more persistently, is the foundation for everything else worth knowing about this medication. Because once you understand how it works, the next question becomes far more important than the hype surrounding it. What does the actual evidence show about its benefits, and just as critically, what are the real risks and side effects that come with a drug this powerful, information that matters enormously if you or someone you know is considering it? Let's talk about what the evidence actually shows, because separating documented benefits from social media hype is where this conversation gets genuinely useful. Starting with blood sugar control, since that remains Ozempic's original and most well-established use. In people with type 2 diabetes, semaglutide has consistently been shown to lower both fasting blood sugar and the spikes that occur after meals, which translates into meaningful improvements in long-term blood sugar markers that doctors track over months, not just single readings. This matters because sustained high blood sugar is what drives many of the serious complications associated with diabetes, including damage to blood vessels, nerves, and organs over time. Beyond blood sugar, one of the more significant findings to emerge from research on this drug class involves cardiovascular health. Studies have found that GLP-1 receptor agonists like semaglutide can reduce the risk of serious cardiovascular events, including heart attacks and strokes, in people with type 2 diabetes who already have heart disease or are at elevated risk for it. This is a meaningful distinction from many earlier diabetes and weight loss medications, some of which either had no clear cardiovascular benefit or, in certain cases, raised safety concerns that eventually led to their withdrawal from the market entirely. Then there's the effect most people actually associate with this drug: weight loss. In clinical trials specifically studying semaglutide for weight management, participants have typically lost somewhere in the range of 10 to 15% of their body weight over the course of a year, with some of the most effective outcomes in the studies reaching upward of 20% for certain patients. To put that in perspective, even a 5 to 10% reduction in body weight is associated with meaningful improvements in blood pressure, cholesterol, blood sugar control, and a reduced risk of conditions like fatty liver disease and obstructive sleep apnea. This is a genuinely significant clinical outcome, which is exactly why this class of medication has generated so much attention within the medical community, not just online. Now let's talk honestly about side effects, because no responsible conversation about this medication is complete without them. The most common side effects are gastrointestinal, and they make sense once you remember that this drug slows digestion. Nausea is the most frequently reported, particularly when a patient first starts treatment or increases their dose. Vomiting, diarrhea, constipation, and stomach discomfort are also commonly reported. For most people, these symptoms are strongest in the early weeks of treatment and tend to ease as the body adjusts, which is exactly why doctors typically start patients on a low dose and increase it gradually over time, rather than jumping straight to a higher dose. Less common, but more serious, side effects also deserve honest attention. Semaglutide carries a warning related to thyroid tumors based on findings in animal studies, and it isn't recommended for patients with a personal or family history of certain thyroid cancers or a rare genetic condition called multiple endocrine neoplasia syndrome type 2. Pancreatitis, an inflammation of the pancreas, has also been reported in some patients, and anyone with a history of pancreatitis should discuss this carefully with their doctor before starting treatment. Gallbladder problems, including gallstones, have been reported as well, which researchers believe may be related to the rapid weight loss itself rather than the drug acting on the gallbladder directly. This is exactly why ongoing monitoring by a physician matters throughout treatment, not just at the start. There are also people for whom this medication generally isn't recommended at all, including anyone who is pregnant or planning to become pregnant, and anyone with the thyroid and pancreatic history mentioned above. And for anyone taking this medication for diabetes management alongside other blood sugar lowering drugs, particularly insulin, careful monitoring becomes especially important, since combining medications can sometimes increase the risk of blood sugar dropping too low. One point that gets lost surprisingly often in the excitement around this medication is that Ozempic was never intended or studied as a replacement for nutrition and physical activity. In every major clinical trial, participants received the medication alongside structured guidance on diet and exercise, not instead of it. The medication reduces appetite and slows digestion, which makes healthier eating patterns considerably easier to sustain for many people, but the underlying habits, adequate protein, regular movement, consistent sleep, still play a meaningful role in both the results people see and how well those results hold up over time. So the evidence paints a picture of a medication with real, well-documented benefits and real, well-documented risks, which is exactly what you'd expect from any medication this powerful. But there's a layer to this conversation that gets far less attention than the benefits and side effects we just covered, the questions people rarely ask before starting, and the ones that become most important after they've already been on it for a while. Let's talk about the questions that tend to come up only after someone has already been on this medication for a while, because this is where a lot of the genuine misunderstanding lives. One of the biggest misconceptions is the idea that Ozempic somehow fixes obesity or type 2 diabetes on its own, as though the underlying condition simply disappears once the medication starts working. That's not quite how it functions. Ozempic manages symptoms and supports weight loss and blood sugar control for as long as someone continues taking it, but it doesn't reverse the underlying biology that led to the condition in the first place. This distinction matters enormously for what happens next, because it directly explains one of the most common questions people have and often don't get a clear answer to before they start. What actually happens after someone stops taking Ozempic? Research following patients after they discontinue semaglutide or similar medications has found that most people experience weight regain, often gradually over the following months. This happens because the appetite-suppressing and digestion-slowing effects fade once the medication leaves the body, and the underlying hunger signals and metabolic patterns that existed before treatment tend to return. This isn't a sign of personal failure, and it isn't unique to this drug. It reflects how these medications work biologically. They manage a condition in real time rather than curing it permanently, similar to how blood pressure medication controls hypertension only for as long as it's taken. This is exactly why many physicians now approach GLP-1 medications as a long-term, potentially indefinite treatment for appropriate patients, rather than a short-term intervention with a defined end date, much the way other chronic conditions are managed. This brings up a comparison people ask about constantly: how Ozempic stacks up against Wegovy and Mounjaro. As we covered earlier, Ozempic and Wegovy share the same active ingredient, semaglutide. They're simply approved for different uses and prescribed at different doses: diabetes management for Ozempic, weight management for Wegovy. Mounjaro is a different medication entirely, built around an active ingredient called tirzepatide, which activates not just the GLP-1 receptor, but a second hormone receptor called GIP as well. This dual mechanism has shown, in head-to-head research, somewhat greater average weight loss compared to semaglutide alone in some studies, though individual results vary considerably from person to person, and factors like tolerability, side effects, and cost all play a meaningful role in which medication ends up being the right fit for a given patient. Neither drug is universally superior. They're simply different tools with somewhat different mechanisms and outcomes, and the right choice depends heavily on an individual's specific health profile, something only a physician reviewing someone's full history can properly determine. So who is genuinely likely to benefit from this class of medication? People with type 2 diabetes struggling to control their blood sugar through diet, exercise, and other medications alone are the population this drug was originally built for, and the evidence supporting its use there is substantial. People with obesity or significant weight-related health conditions like high blood pressure or sleep apnea, who haven't achieved lasting results through lifestyle changes alone, may also be reasonable candidates, particularly under a physician's guidance and ongoing monitoring. And who might this not be right for? Anyone looking for a short-term fix before an event? Anyone unwilling or unable to commit to the ongoing monitoring and potential long-term nature of this treatment? And anyone with the specific medical history we discussed earlier, personal or family thyroid cancer history, a history of pancreatitis, or pregnancy, should approach this medication with real caution and a thorough conversation with their doctor before considering it at all. It's also worth being honest that access and cost remain significant real-world barriers for a lot of people, and that gap between who could medically benefit and who can actually access consistent, affordable treatment is one of the more important and least discussed parts of this entire conversation. So where does that leave us? Ozempic and the broader class of GLP-1 medications it belongs to represents a genuinely significant advancement in how medicine approaches both type 2 diabetes and obesity, grounded in real biology and supported by substantial clinical evidence. But it isn't a miracle, it isn't a shortcut, and it isn't the right choice for everyone. Like any powerful medical tool, its value depends entirely on whether it's used by the right person, for the right reason, under real medical guidance, alongside the lifestyle habits that continue to matter regardless of what medication someone is taking. If this video helped you understand the actual science behind one of the most talked about medications in the world, rather than just the headlines surrounding it, consider giving it a like and subscribing for more clear, evidence-based breakdowns of the health topics everyone's discussing, but few people fully understand. And if you or someone you know is considering this medication, the most valuable next step isn't another video or article, it's an honest conversation with a doctor who can look at your specific health history and help you determine whether it's genuinely the right fit. Thanks for watching, and I'll see you in the next one.